Imagine a virus that has been circulating quietly for decades, causing symptoms similar to the common cold. Now, envision this virus experiencing a surge in cases, leading to overwhelmed hospitals and raising global concerns. This isn't a scene from a dystopian novel. It's the current situation with human metapneumovirus, or HMPV. As reports emerge of crowded hospitals in China and rising cases elsewhere, many are asking, is HMPV the next pandemic threat? Should we be worried? And what steps can we take to protect ourselves and our loved ones? Let's delve into everything you need to know about HMPV. HMPV is a respiratory virus first identified in 2001 by Dutch researchers, though retrospective studies suggest it has been affecting humans for decades. Belonging to the Pneumoviridae family, HMPV is closely related to the respiratory syncytial virus, also known as RSV, and typically causes symptoms akin to the common cold, such as cough, fever, nasal congestion, and wheezing. In certain cases, especially among young children, the elderly, and individuals with weakened immune systems, it can lead to more severe respiratory conditions like bronchiolitis, bronchitis, or pneumonia. As of early 2025, there has been a notable surge in HMPV cases in various regions, particularly in China. Reports indicate that hospitals, especially pediatric departments, are experiencing a significant influx of patients presenting with respiratory symptoms. This increase has raised public health concerns, drawing parallels to previous viral outbreaks. However, it's crucial to understand that HMPV is not a novel virus, and its current resurgence aligns with known seasonal patterns. In India, health authorities have confirmed cases of HMPV in Karnataka and Gujarat. The Indian Council of Medical Research reported 2 cases in Bengaluru, while civic authorities in Gujarat have identified a case in Ahmedabad. These developments have prompted advisories urging the public to adhere to preventive measures similar to those recommended during the COVID-19 pandemic, such as wearing masks, practicing hand hygiene, and maintaining social distancing when necessary. But should we be worried that HMPV could become the next COVID? The answer, fortunately, is no. While it's understandable that people draw parallels to COVID-19, HMPV lacks several key factors that made COVID a global pandemic. For one, HMPV has a lower transmissibility rate. Most infections are mild, and while it can lead to complications in vulnerable populations, the majority of people recover without medical intervention. Importantly, this virus has been around for a long time, so there's no evidence to suggest it poses a pandemic-level threat. Still, prevention is better than cure. Stopping the spread of HMPV involves maintaining good hygiene. Washing your hands regularly with soap and water is crucial, especially before eating or after being in public places. If you don't have access to soap, use an alcohol-based hand sanitizer. Avoid touching your face, particularly your nose, mouth, and eyes, since these are the easiest entry points for the virus. And if you're feeling under the weather, it's best to stay home and rest to avoid passing the virus to others. Another critical step is respiratory hygiene. Cover your nose and mouth with a tissue or your elbow when you cough or sneeze, and make sure to dispose of tissues immediately. Disinfect commonly touched surfaces like doorknobs, phone screens, and countertops frequently. These small steps can make a big difference in controlling the spread of not just HMPV, but other respiratory infections as well. Now, who is most at risk? While HMPV can affect anyone, certain groups are more vulnerable to severe complications. Infants and young children, especially those under 5, are at higher risk because their immune systems are still developing. Older adults, particularly those over 65, are also susceptible due to age-related immune decline. People with pre-existing health conditions, like chronic lung diseases such as asthma, or those with heart conditions, face an increased risk as well. Additionally, individuals with weakened immune systems, whether due to conditions like HIV cancer treatments or organ transplants, should take extra precautions. Currently, there is no specific antiviral treatment or vaccine available for HMPV. The management of the virus focuses on alleviating symptoms. Rest and hydration are your best allies here. Drinking plenty of fluids keeps you hydrated and helps the body recover faster. Over-the-counter medications like your common medications can be used to reduce fever and ease discomfort, but always follow dosing instructions and consult a doctor before consumption. In severe cases, hospitalization might be required for oxygen therapy or intravenous fluids. It's important to note that antibiotics won't work against HMPV because it's a virus, not a bacterial infection. If you're unsure about symptoms, consult a healthcare provider for guidance, especially if symptoms worsen or don't improve after a few days. Globally, public health authorities are keeping a close eye on the recent surge in HMPV cases. While the situation is concerning, experts are confident that it doesn't pose the same level of threat as COVID-19. The rise in cases aligns with seasonal trends, and healthcare systems are better equipped to handle respiratory viruses now than they were a few years ago. In conclusion, while HMPV is making headlines, it's not a cause for panic. By understanding the virus and adopting preventive measures, we can protect ourselves and those around us. The lessons we've learned from recent years have prepared us well to face such challenges. Stay informed, stay safe, and remember, a little vigilance goes a long way in keeping respiratory viruses at bay. If you found this video helpful, make sure to hit the like button, subscribe to our channel, and turn on notifications so you never miss an update. Let us know in the comments, what precautions are you taking to stay safe this season? Thanks for watching, and we'll see you next time.